You're listening to All Things ADHD, produced by CHADD's National Resource Center on ADHD. Learn more at chadd.org. That's CHADD.org.
Hello, welcome to the All Things ADHD podcast. I'm Dr. David Marks, Clinical Associate Professor of Child and Adolescent Psychiatry at the Child Study Center at NYU Langone Health, and a member of the CHADD Professional Advisory Board. It gives me great pleasure to welcome you to today's CHADD NRC podcast on fathers and ADHD. My guest is Dr. Anil Chacko, Associate Professor of Psychology and Chair of the Department of Applied Psychology at the NYU Steinhardt School of Culture, Education, and Human Development. Dr. Chacko represents the embodiment of a scientist practitioner whose research focuses on engaging effective and sustainable prevention, intervention, and service delivery models for youth at risk for ADHD or affected with disruptive behavior disorders. He's been the beneficiary of numerous NIH and foundation grants, and his work has been closely informed by his clinical work with families and an active collaboration with service providers in the community. On a personal note, I've had the privilege of collaborating with Dr. Chacko on a handful of research studies examining the efficacy of novel therapeutic interventions for ADHD, and I'm truly fortunate to consider him both a colleague and a friend. So welcome, Dr. Chacko, and thank you for joining me for today's podcast.
Thanks so much, David, for the warm introduction. I'm looking forward to our conversation.
Same. So just to get us started, I was wondering if you can begin by telling us a little bit about what the research seems to indicate regarding the prevalence of ADHD among fathers, and I guess related to that, how this figure could be impacted by the presence of ADHD among their offspring.
Sure, yeah. So there is data on adult men with ADHD, but there's not a clean population estimate specifically for, quote, fathers with ADHD. Adult ADHD is more common in men than women in most studies. And I know that in one large U.S. survey, estimated current adult ADHD prevalence to be about 4.4%, with more men than women who are affected. CHADD also summarizes U.S. adult ADHD as affecting about the same 4.4% of adults, with men representing a larger share of diagnosed adults. So while we cannot say exactly how many fathers have ADHD, we can say that a substantial number of fathers likely do, because many adults with ADHD are men and many are parents. The more clinically useful point is that paternal ADHD is common enough that clinicians should routinely ask about it in families affected by ADHD. And then your second question, David, if you don't mind repeating it.
Yeah, of course. So it relates to how the prevalence of ADHD among fathers may be impacted by whether they have a child of their own with ADHD. Might we expect there to be an elevated prevalence of ADHD among fathers when there exists ADHD in their offspring?
Yeah, so because it is quite heritable, a good indicator or a potential follow-up for clinicians who work with families who has a child with ADHD is to work off the assumption that there's a high likelihood that there will be paternal ADHD. So it does make sense to screen for that, especially when we're thinking about treatment planning at the family level. Sometimes what that means is that not only will fathers be involved as they should be in working with their child in parent training, but also if the father has hallmarks of ADHD or is diagnosed with ADHD, that they could benefit from their own personal therapy. And certainly we can talk more about what that could look like.
Yeah. So picking up on that, we know, of course, ADHD presents not just in children, but also in adults in a fairly eclectic or heterogeneous manner. So I was wondering if you can speak to how or the manner in which ADHD in fathers might impact their caregiving experiences and perhaps as well their professional experiences, which may indirectly impact their functioning within a family sort of system.
Yeah, so in terms of just parenting, we know that one consistent finding is that fathers' ADHD symptoms and parenting involvement can shape their kids' behavior. So it's not that parents engage, it's how they engage and how they're involved. We know that, as an example, there have been a few studies that have found that paternal ADHD symptoms are associated, at least, with more child conduct problems only when fathers were highly involved in caregiving using certain kind of parenting approaches that are more punitive and authoritative, which suggests that involvement can be in strength when fathers engage in ways with their child that supports their child's well-being, and it can be detrimental when fathers engage in ways that are not supportive. But this is true across all fathers, not just fathers with ADHD. We do know that father-child relationships often differ from mother-child relationships, and that's important. Fathers can experience real strain from their child's ADHD symptoms, especially when behavioral problems and school concerns or conflicts at home become chronic. Research shows that fathers may respond with more control and more frustration or less emotional support when they're coping with the child's ADHD related dysregulation. And then fathers with ADHD themselves may especially feel vulnerable to feeling overwhelmed by organizational demands, consistency demands, emotion regulation demands. That's not only true at home, but also at the workplace, as certainly these kinds of features of ADHD permeate in different kinds of settings. So depending on the demands of the workplace and the requirements for organization, time management, and planning and consistency, and then the ability to regulate your emotions when work is stressful is going to have a significant impact on how a man with ADHD, a father with ADHD will perform in the workplace, and certainly can be compounded when those challenges appear not just at work, but also at home.
Yeah. So I guess if I'm hearing you correctly, it sounds like within a family system, the presence of ADHD symptoms among children has on its own an impact or has the potential to impact the integrity or functioning of a family system, but that the presence of ADHD symptoms in a caregiver, including their father potentially, might act in a synergistic fashion, or maybe to state it differently, to more adversely impact the functioning or the dynamics of a family arrangement relative to the presence of ADHD symptoms in the child alone.
Right, that's correct. So, for folks who are parents, this is not necessarily unique to fathers with ADHD or kids with ADHD, families with ADHD. It's true across the board. There is a reciprocal process by which parents influence their kids and kids influence their parents. And so, it's not uncommon for kids' challenging behavior to cause a lot of stress and result in ineffective, authoritative, punitive parenting. And that kind of parenting behavior can lead to emotion dysregulation in their kids subsequently. And so this kind of cycle is common in a lot of families, more frequent and more significant in families where there's a child with ADHD and or a parent, including a father with ADHD. This kind of family coercive process was identified decades ago, largely in the area of conduct problems and oppositional problems, but certainly has its place as a model to think about when considering family dynamics.
Yeah, no, thank you for that. We spoke a few moments ago about the fact that a child's ADHD diagnosis is oftentimes a trigger or an inspiration, perhaps, for parents, caregivers, and in this case, fathers, to consider an evaluation for themselves. And I guess I'm curious, outside of those types of circumstances, what is oftentimes the most efficient or effective vehicle for a father to enlist evaluation related services? And I guess the second part would be, outside of ADHD, what are oftentimes common co-occurring issues that may sort of encircle or accompany ADHD symptoms among fathers?
Yeah, good question. So, there is a fair amount of data around the comorbidity of ADHD and mood and anxiety issues and substance use issues in men fathers who have ADHD. And so ADHD may cause real challenges, interpersonal relationships, men, fathers may have difficulties regulating their emotions, whether it looks like anxiety or mood issues, and can oftentimes use substances, including alcohol, to help regulate those strong emotions. And that obviously has an impact on their ability to function well in multiple domains, whether it's at work or at home or interpersonally with coworkers or their significant others and their children. And oftentimes it's this kind of combination of things not working well for them and approaches that they have tried to help manage their ADHD and manage their mood that has not gone well. That leads men to decide later on, unfortunately, probably after some difficulties have been relatively chronic, to finally seek out services. Sometimes I've found that fathers will start services because their significant other has been exhausted by the demands of parenting and feeling like they're parenting solo and not getting the kind of support from their spouse or significant other that they're looking for. Certainly, ADHD in men and in women can increase the likelihood of marital difficulties. And that's another reason that women with ADHD will present for assessment and treatment. So there's a combination of substance use issues at times, certainly mood and anxiety that are comorbid with ADHD that impacts multiple domains, interpersonal relationships, and functioning in different ways for different men, different fathers, but ultimately then lead to a recognition that they may need some additional support.
Excellent. Thank you for that. And so if there was an adult who presents with ADHD who was interested in trying to establish clarity as to whether their characteristics or symptoms rise to the level of something diagnostic, in adults or for a father, what might be the most effective means by which to enlist an evaluation or support?
Yeah. So the ideal approach would be to be able to work with a mental health professional who utilizes evidence-based assessments for the diagnosis of ADHD. Unfortunately, I think, at least here in the US, those types of providers, it's difficult to access them and to be able to get timely appointments. And so that's a real challenge in mental health broadly, including adult ADHD. I would recommend that men who are interested in pursuing, trying to get a better understanding of perhaps this is ADHD, to consider really good general practitioners who may be well versed, have a good understanding of adult mental health, including ADHD. That is probably the lowest barrier of entry for a lot of men. General practitioners certainly serve a wide array of difficulties experienced by adults, both physical and mental health challenges, and would be a good, at least, initial source. I would say, in addition to that, if that is the easiest way to access a professional for the purpose of an assessment, you can do that, but in parallel, continue to pursue a more specialized professional who may be able to provide a more in-depth assessment and treatment planning for ADHD. I think the big challenge in our healthcare system is there's a lot of need, but unfortunately, there's not a lot of access and availability to services, especially evidence-based assessments and treatments.
In a recent line of work, Russell Barkley has stipulated that men with ADHD tend to live shorter lives than their unaffected counterparts. Can you maybe speak a little bit to what the studies suggest might be the reason for this, or what might be contributing to early death or morbidity for men impacted by ADHD?
Yeah, I mean, I think the data is important and men should certainly take it very seriously. But it's not a sentence or a prophecy. Recent peer-reviewed work, there was a study done in a large UK primary care data set that found that adults diagnosed with ADHD had a reduced life expectancy, including about almost 7 years fewer for men compared to men without ADHD. And earlier US work, as you mentioned, Russ Barkley's work also found higher odds of mortality in adults with ADHD. And they suggested accidents as an important contributing cause. So probably the best interpretation is that the elevated risk is real, but it's likely driven by modifiable factors, not ADHD itself. as a direct biological cause of death. So the reasons appear to include higher rates of accidents and injury, car accidents, in particular, comorbid mental health conditions, as I mentioned before, severe anxiety, depression, substance use risk, certain kinds of behaviors that increase the risk of premature death, including smoking, and certainly healthcare disengagement. Men in general are less engaged in their own healthcare. Men with ADHD, because of the challenges with follow through, time management planning, which is required for medication management, et cetera, are probably even more disengaged. And certainly, depending on outcomes for men in regards to education and occupation, there may be certain kinds of social disadvantages for certain groups of men with ADHD that make it much more difficult for them to engage in healthcare and their own health. So I think the message is not ADHD shortens life no matter what, and that ADHD is some kind of sentence. The message is that untreated or poorly managed ADHD can increase risk, but that risk can be reduced with effective support and treatment.
Thank you so much for that. And sort of piggybacking on that, what are the leading evidence-based treatments for adult men, including fathers with ADHD, that could meaningfully support the continuum of symptoms and functional consequences that they may face?
So when I think about, perhaps we can talk about this as men and then also fathers. Treatment can certainly make a meaningful difference, not only in ADHD symptoms, but also functioning. So there's been some recent work on adult ADHD that notes that stimulants and atomoxetine have clear, at least short-term efficacy for ADHD symptoms. And behavioral interventions like CBD for adult ADHD, interventions that focus on a cognitive behavioral treatment model, or those that focus in addition to executive functioning kinds of deficits, which include supporting organization, time management, and planning, can certainly help with everyday challenges with ADHD. I think that beyond these kinds of evidence-based approaches, there are just lifestyle kinds of things that adults with ADHD, men with ADHD can do, especially those that reduce impulsive risk and increase consistency. So foundational things that are important for all people, but in particular could be helpful for men with ADHD, includes things like regular sleep, sleep hygiene, physical activity, really limiting substances like alcohol or drug misuse, smoking, efforts at better medication adherence. If you're on an ADHD medication, it really does only work if you're using it consistently. And developing with CBT for adult ADHD and related kinds of interventions, really developing routines that can help minimize the impact of ADHD on their habits. So improving the ability to follow through on things and be consistent and avoid last minute crises. So again, reminders, alarms, external structures, all those kinds of things in addition to foundational lifestyle habits can have a significant impact if it's done consistently. The goal with adult ADHD treatment is not to work harder per se or try to increase your willpower. The goal is to work smarter through systems that you can implement with some support from a professional.
And then lastly, thinking about the functional impact of some of these interventions that you've just been describing, I guess beyond the manner in which they help to rein in or mitigate ADHD symptoms per se, is there any data on how it impacts their functioning as a father, or for that matter, how management of ADHD symptoms can impact the quality or the integrity of sort of a family unit or functioning?
Yeah, great question. I'll say that there has been research recently, and I say recently, really in the last 10 years, that have focused on addressing parents with ADHD as a way of improving their children's functioning, their child with ADHD. But the majority of this has been done with mothers, not fathers. So there's been work on whether providing mothers with ADHD medication, if that improves their ADHD symptoms, so they're going to be more receptive to trying out evidence-based parenting intervention. So There hasn't been a lot of work done with fathers per se. The work that has been done has largely focused on fathers parenting. There's been some work on different ways of engaging fathers in what's considered evidence-based parent training kinds of programs through different formats like sports-oriented formats, things that are a bit more hands-on, which align more with how fathers engage with their kids, at least traditionally. So the ways in which intervening for fathers as a way of improving kids' outcomes really still is about engaging fathers in parent training or behavioral parent management programs. And there's a host of these. I know Chad also has a parenting intervention that has foundational evidence-based parenting topics. But things like parent management training, Triple P, all those kinds of evidence-based parenting interventions, really teach practical skills like consistent routines and positive reinforcement and predictable consequences. For fathers specifically, the strategies that tend to help most are the ones that lower chaos in the house. So keeping routines visible, reducing verbal overload, that's often common in fathers with ADHD, including giving instructions one at a time, praising more often than you criticize, helping with transitions. Chad also emphasizes programs that help parents create a safe, kind of interesting environment and use assertive discipline and take care of themselves as parents. All those things are really important. Fathers can also engage in school-based supports, coaching. There are a lot of resources that Chad has as well online that can help fathers better understand the impact of ADHD as an adult parent on family functioning and how best to support their child as well.
And it does sound like in many ways that the age-old oxygen mask metaphor, right? So ensuring that the father in this particular case effectively manages and supports their own behavioral and functional needs can be a critical measure to ensuring that they're available to support the needs of those that rely on and depend upon them. So I want to personally thank you, Dr. Chacko, for joining me for a thoroughly insightful and informative discussion about fathers and ADHD. Information regarding this and other podcasts related to ADHD can be found through the CHAD website at www.chad.org. Thank you so much.
All right. Thank you.
Thank you for listening to All Things ADHD, produced by CHAD's National Resource Center on ADHD. Learn more at chad.org. That's CHADD.org.